Morning sickness is a common symptom experienced by many women during the early stages of pregnancy. It typically begins in the first trimester and can last for several weeks, but in some cases it can persist throughout the pregnancy. It is important to note that while the term morning sickness implies that the symptoms occur only in the morning, they can occur at any time of the day or night. Important to note that while morning sickness is a common symptom of pregnancy, not all women experience it. Please support us out by subscribing to our channel and liking and sharing the video. What is morning sickness? Morning sickness is characterized by nausea and/or vomiting during pregnancy. Symptoms of morning sickness can vary from person to person and can include nausea, vomiting, dizziness, fatigue, and food aversions or cravings. For some women, morning sickness is mild and does not interfere with daily life, but for others, it can be severe and may require treatment. Why do pregnant women get morning sickness? The exact cause of morning sickness in pregnant women is not fully understood, but there are several possible causes that are believed to contribute to the development of this condition. Hormonal changes. The increase in the hormone HCG, human chorionic gonadotropin, and other pregnancy-related hormones, such as estrogen and progesterone, are believed to play a role in the development of morning sickness. These hormones can affect the way the stomach empties and can lead to feelings of nausea and vomiting. Blood sugar changes. During pregnancy, a woman's blood sugar levels may fluctuate, which can cause feelings of nausea and vomiting. Psychological factors. Stress, anxiety and depression can also cause morning sickness in some women. Gastrointestinal issues. Women who have a history of gastrointestinal problems, such as acid reflux or motion sickness, may be more likely to experience morning sickness during pregnancy. How long does morning sickness last? The duration of morning sickness can vary from woman to woman. For some women, it may last only a few weeks, while for others, it may last the entire first trimester or even throughout the entire pregnancy. Typically, morning sickness begins around the 6th week of pregnancy and peaks at around the 8th to 9th week. What should I do if my morning sickness is severe? If your morning sickness is severe and interfering with your daily life, it's important to talk to your healthcare provider for guidance and support. They can provide you with advice on how to manage your symptoms and can recommend treatments or medications to help you cope. Here are some things you can do if your morning sickness is severe. Keep a food diary. Keeping track of when you experience nausea and what foods trigger it can help you identify patterns and make adjustments to your diet. Stay hydrated. Drink water or other clear fluids throughout the day to stay hydrated, and try to avoid beverages that can dehydrate you, such as caffeine. Get plenty of rest. Being tired can make nausea worse, so make sure to get enough sleep and rest. Eat small, frequent meals. Eating something small every 2-3 hours can help keep your stomach from getting empty, which can make nausea worse. Avoid foods and smells that trigger nausea. Different things can cause nausea in different people, but common triggers include strong smells, greasy or fried foods, and spicy or sweet foods. Relaxation techniques. Yoga, meditation, and deep breathing exercises can help relieve stress, which can worsen morning sickness symptoms. Acupressure bands. These bands can be worn on the wrists and apply pressure to the P6 point, which is thought to help alleviate nausea and vomiting. Use essential oils. Some aromatherapy oils, like peppermint and ginger, can help soothe nausea. It's generally a good idea to consult with your healthcare provider if you're experiencing severe or persistent morning sickness, especially if it's causing weight loss or dehydration, or if you're struggling to keep food and fluids down. They will evaluate your symptoms and provide guidance and support. They can also rule out other causes of nausea and vomiting and make sure that your pregnancy is progressing normally. Please like, share and subscribe our channel and support